What if I told you that intimacy after 60 isn't just about pleasure? It's a gateway to better health, stronger relationships, and a more fulfilling life. Today, we're breaking the silence on a topic often whispered about but rarely discussed: how oral intimacy impacts your body, mind, and the bond you share with your partner. Whether you're curious, concerned, or simply looking for ways to enhance your well-being, this video is packed with insights, tips, and surprising truths that could transform how you view intimacy in this stage of life. Stay with me, because what you're about to learn might just change everything. This video is designed to serve as a comprehensive guide, shedding light on a topic that is often overlooked or considered taboo, especially when it comes to older adults. The primary goal is to educate and inform, but not in a clinical or detached way. Instead, we aim to create a safe, open, and judgment-free space where viewers can explore the multifaceted impacts of oral intimacy, not just as a physical act, but as a practice that touches every aspect of life: the body, the mind, and the heart. For men between the ages of 60 and 88, this stage of life brings unique challenges and opportunities. It's a time when health concerns may become more prominent, relationships may evolve, and the way we view intimacy might shift. This video seeks to address these changes head-on, offering practical advice, scientific insights, and emotional support to help navigate this important aspect of life with confidence and clarity. The focus here is not just on the act itself, but on the broader implications it has for overall well-being. We'll explore how oral intimacy can influence physical health, everything from heart health to immune function, and how it plays a role in emotional and psychological well-being. For many, this practice is more than just a physical connection. It's a way to reaffirm bonds, express care, and maintain a sense of vitality and purpose. But with these benefits come responsibilities. We'll also discuss the importance of balance, hygiene, and communication to ensure that this aspect of life remains fulfilling and safe. This isn't about pushing any particular agenda or promoting one way of living over another. It's about providing information and tools so that each individual and couple can make informed decisions that align with their values, desires, and health needs. Now, let's talk about who this video is for. While the primary audience is men aged 60 to 88, this content is equally relevant for their partners, whether they're spouses, long-term companions, or new romantic interests. Intimacy is a shared experience, and understanding its nuances can help both parties feel more connected and supported. But the reach of this video extends even further. If you're someone who cares about aging well, maintaining strong relationships, or simply understanding the science and psychology behind intimacy, this video is for you. It's for adult children who want to better understand the needs of their aging parents. It's for healthcare professionals who want to approach these conversations with more empathy and knowledge. And it's for anyone who believes that intimacy, at any age, is a vital part of what makes us human. This video is also for those who may feel hesitant or uncertain about discussing this topic. Society often shies away from conversations about intimacy and aging, leaving many people feeling isolated or misunderstood. By addressing this subject openly and compassionately, we hope to break down those barriers and create a space where questions are welcomed, concerns are validated, and solutions are offered. Whether you're in a long-term relationship, exploring new connections, or simply curious about how intimacy evolves with age, this video is here to provide guidance, reassurance, and practical tips. Ultimately, the purpose of this video is to empower. It's about giving you the knowledge and confidence to approach this aspect of life with intention and care. It's about recognizing that intimacy doesn't have an expiration date. It evolves, adapts, and can continue to be a source of joy, connection, and health well into later life. So, whether you're here to learn, to reflect, or to start a conversation with someone you care about, we're glad you're here. Let's dive in together and explore how this deeply personal practice can be a powerful tool for living a fuller, healthier, and more connected life. When it comes to discussing a topic as personal and sensitive as intimacy, especially in the context of aging, the tone and approach are absolutely critical. This isn't just about sharing information, It's about creating an environment where viewers feel comfortable, respected, and understood. That's why, throughout this video, you'll notice a careful balance between professionalism and empathy. As a urologist with years of experience, I bring a level of expertise and credibility to the conversation. But more than that, I bring a deep understanding of the human side of these issues. This isn't just about the science or the mechanics, it's about the lived experiences of real people navigating this stage of life. That's why the tone here is warm, compassionate, and non-judgmental. We're not here to tell you what you should or shouldn't do. Instead, we're here to provide you with the information and tools you need to make decisions that feel right for you and your partner. This approach is especially important because, for many, topics like oral intimacy can feel uncomfortable or even taboo to discuss. There's often a sense of shame or embarrassment that comes with acknowledging these aspects of life, particularly as we age. But here's the thing, there's absolutely nothing to be ashamed of. Intimacy is a natural, healthy, and important part of being human, no matter your age. By approaching this topic with openness and understanding, we hope to break down those barriers and create a space where you feel safe to explore, ask questions, and reflect on your own experiences. This isn't just a lecture, it's a conversation. And in that conversation, your feelings, concerns, and perspectives are not just valid, they're essential. At the same time, this video is designed to be engaging and interactive. We want you to feel like an active participant in this discussion, not just a passive observer. That's why we'll be encouraging you to share your thoughts, ask questions, and engage with the content in meaningful ways. Whether it's leaving a comment, sharing your own experiences, or simply reflecting on what you've learned, your voice matters. This isn't just about us talking to you, it's about creating a dialogue where we can learn from each other. By fostering this sense of community, we hope to make this video not just informative, but also supportive and empowering. One of the ways we'll be encouraging this interaction is by inviting you to share your thoughts in the comments. Do you agree with the points we're making? Do you have questions or concerns that haven't been addressed? Have you had experiences that you'd like to share? Your input is invaluable, not just to us, but to the entire community of viewers who are here to learn and grow. We'll also be asking you to like the video if you find it helpful, and to subscribe to the channel if you want to stay updated on future content. These small actions might seem simple, but they make a big difference in helping us reach more people with this important information. Another key aspect of our approach is accessibility. We understand that not everyone has the same level of knowledge or comfort when it comes to these topics. That's why we'll be breaking down complex ideas into simple, easy-to-understand terms. Whether you're someone who's well-versed in the science of intimacy or someone who's just starting to explore these ideas, this video is designed to meet you where you are. We'll be using clear, straightforward language, and we'll be providing plenty of examples and analogies to help illustrate our points. Our goal is to make sure that everyone, regardless of their background or experience, can walk away from this video feeling informed and empowered. Finally, it's important to note that this video is not just about providing answers, it's about sparking reflection. We want to encourage you to think deeply about your own experiences, your relationships, and your health. What does intimacy mean to you? How has it evolved over the years? What are your hopes and concerns when it comes to this aspect of your life? These are big questions, and they don't always have easy answers. But by asking them, and by engaging with the ideas we'll be discussing, you're taking an important step toward living a more intentional, fulfilling, and connected life. So, as we move forward, we invite you to approach this video with an open mind and an open heart. Whether you're here to learn something new, to feel less alone in your experiences, or to start a conversation with someone you care about, we're glad you're here. Together, let's explore this important topic with curiosity, compassion, and a shared commitment to living well at every stage of life. When we talk about oral intimacy, it's impossible to ignore its profound impact on physical health. This isn't just about the immediate sensations or the pleasure it brings. It's about how this practice can influence your overall well-being in ways you might not have considered. Let's start with the benefits, because there are quite a few that are backed by science and worth celebrating. For instance, engaging in oral intimacy can be a powerful stress reliever. In today's fast-paced world, stress is something that affects almost everyone, and it can take a serious toll on both your mental and physical health. But here's the good news. When you engage in intimate activities, your body releases hormones like oxytocin and endorphins. These are often referred to as the feel-good hormones, and for good reason. Oxytocin, sometimes called the love hormone, helps create feelings of bonding and connection, while endorphins act as natural painkillers and mood boosters. Together, these hormones can help you feel more relaxed, happier, and more connected to your partner. But the benefits don't stop there. Did you know that oral intimacy can also have a positive impact on your heart health? It's true. The physical activity involved, even if it's not intense, can get your blood flowing and your heart pumping in a healthy way. This can help improve circulation, lower blood pressure, and even reduce the risk of cardiovascular issues over time. And let's not forget about the immune system. Regular, intimate activity, including oral intimacy, has been shown to boost immune function. This is partly because of the reduction in stress hormones like cortisol, which can weaken the immune system when levels are too high. By engaging in activities that promote relaxation and happiness, you're giving your body a natural boost that can help you stay healthier in the long run. Of course, like any aspect of life, balance is key. While there are many benefits to oral intimacy, it's also important to be aware of the potential risks and take steps to minimize them. One of the most common concerns is hygiene. Poor oral hygiene can lead to a host of problems, from bad breath to more serious issues like infections or gum disease. This is especially important for older adults, who may be more vulnerable to these kinds of health issues. That's why it's crucial to maintain good oral hygiene practices, not just for the sake of your partner, but for your own health as well. Brushing your teeth regularly, using mouthwash, and staying on top of dental checkups are all simple but effective ways to reduce the risk of complications. Another risk to be aware of is repetitive strain. While oral intimacy is generally a low-impact activity, it's still possible to overdo it, especially if you're dealing with pre-existing conditions like arthritis or muscle tension. Paying attention to your body and taking breaks when needed can help prevent discomfort or injury. And then, there's the issue of sexually transmitted infections, or STI. This is a topic that often gets overlooked, especially among older adults, but it's just as important now as it was in your younger years. If you're not in a monogamous relationship where both partners have been tested, it's essential to take precautions. Using protective barriers like dental dams can significantly reduce the risk of transmission and help keep both you and your partner safe. Speaking of precautions, regular medical checkups are another key component of maintaining your physical health. This is true not just for oral intimacy, but for your overall well-being. As we age, our bodies change, and it's important to stay on top of those changes. Regular visits to your doctor and dentist can help catch potential issues early before they become more serious. And don't be afraid to bring up topics like intimacy during these visits. It might feel awkward at first, but your healthcare provider is there to help, not to judge. They can offer personalized advice and recommendations based on your unique health needs. Finally, let's talk about the importance of listening to your body. This is something that becomes even more crucial as we get older. Your body has a way of telling you when something isn't right, whether it's through pain, fatigue, or other symptoms. If you notice any discomfort during or after intimate activities, it's important to pay attention and take action. This might mean adjusting your approach, taking a break, or seeking medical advice. Remember, the goal is to enjoy these moments in a way that feels good and supports your health, not to push through discomfort or ignore warning signs. In summary, oral intimacy can have a wide range of physical health benefits, from reducing stress and improving heart health to boosting your immune system. But it's also important to be mindful of the potential risks and take steps to protect yourself and your partner. By maintaining good hygiene, being aware of your body's limits, and staying on top of your health through regular checkups, you can enjoy the benefits of intimacy while minimizing the risks. It's all about finding that balance between pleasure and safety between connection and self-care. And when you get that balance right, the rewards can be truly transformative. When we think about intimacy, it's easy to focus on the physical aspects, the sensations, the mechanics, the immediate pleasure. But what often gets overlooked is the profound impact that intimacy can have on our emotional and psychological well-being. This is especially true for older adults who may be navigating significant life changes, such as retirement, the loss of loved ones, or shifts in their physical health. In this stage of life, intimacy, including oral intimacy, can play a crucial role in maintaining emotional balance, fostering connection, and even boosting mental health. Let's start with the idea of connection and bonding. At its core, intimacy is about more than just physical closeness. It's about emotional closeness as well. For many couples, especially those who have been together for decades, oral intimacy can be a powerful way to reaffirm their bond. It's an act of care, of giving and receiving, that goes beyond words. When both partners are fully present and engaged, it creates a sense of unity and mutual understanding that can strengthen the relationship in profound ways. For men in particular, this practice can also be a way to reaffirm their sense of masculinity and self-esteem. In a world where aging is often associated with decline, being able to give and receive pleasure can be a powerful reminder that vitality and desire don't have an expiration date. But the benefits of intimacy extend far beyond the relationship itself. On an individual level, maintaining an active, intimate life can have a significant impact on mental health. Let's talk about depression, for example. It's no secret that depression is a common issue among older adults, often linked to feelings of loneliness, isolation, or a lack of purpose. Intimacy, including oral intimacy, can be a natural antidote to these feelings. When you engage in intimate activities, your brain releases a cocktail of hormones, including oxytocin, endorphins, and dopamine. These chemicals are like nature's antidepressants. They boost your mood, reduce feelings of stress and anxiety, and create a sense of happiness and contentment. For many people, these moments of connection can be a bright spot in their day, a reminder that they are loved, desired, and valued. Sleep is another area where intimacy can make a big difference. Many older adults struggle with sleep issues, whether it's difficulty falling asleep, staying asleep, or getting restful sleep. The relaxation and stress relief that come with intimacy can help improve sleep quality, making it easier to drift off and stay asleep through the night. And let's not forget about the sense of purpose and vitality that intimacy can bring. As we age, it's common to feel like certain chapters of life are closing, whether it's the end of a career, children moving out, or other life transitions. Intimacy can be a way to reclaim a sense of aliveness and excitement, to remind yourself that life is still full of possibilities and pleasures. Of course, it's important to acknowledge that intimacy isn't a cure-all for mental health issues. If you're struggling with depression, anxiety, or other psychological challenges, it's essential to seek professional help. But intimacy can be a valuable part of a holistic approach to mental health, complementing other treatments and strategies. It's about creating a life that feels rich, meaningful, and connected, not just physically, but emotionally and psychologically as well. Another important aspect of emotional well-being is the role of communication in intimacy. For many couples, discussing desires, boundaries, and feelings can be a deeply bonding experience. It's an opportunity to be vulnerable, to listen, and to understand each other on a deeper level. This kind of open communication can help prevent misunderstandings, reduce tension, and create a stronger foundation of trust and respect. And when both partners feel heard and valued, it can enhance the emotional benefits of intimacy, making the experience even more fulfilling. It's also worth noting that intimacy can be a source of joy and playfulness, even in later life. As we age, it's easy to fall into routines or to take life too seriously. Intimacy can be a way to break out of those patterns, to laugh, to explore, and to enjoy the moment. It's a reminder that life doesn't have to be all about responsibilities and obligations. It can also be about pleasure, connection, and fun. In summary, the emotional and psychological benefits of intimacy, including oral intimacy, are vast and multifaceted. From strengthening bonds and boosting self-esteem to improving mental health and sleep, the impact goes far beyond the physical. By approaching intimacy with intention, care, and open communication, you can create a richer, more fulfilling emotional life, one that supports your well-being and enhances your relationships. It's about recognizing that intimacy is not just a luxury or an afterthought. It's a vital part of what makes us human at every stage of life. Intimacy, in any form, is not just a physical act. It's a shared experience that involves emotions, trust, and connection. This is why the dynamics of a relationship play such a crucial role in how intimacy is experienced and enjoyed. At the heart of these dynamics are two key elements: communication and respect for boundaries. These are the pillars that hold up a healthy, fulfilling, intimate life, especially as we age and navigate the changes that come with it. Let's start with communication, because it truly is the foundation of any strong relationship. When it comes to intimacy, open and honest dialogue between partners is absolutely essential. This means being able to talk about your desires, your concerns, and your feelings without fear of judgment or rejection. For many couples, especially those who have been together for a long time, it's easy to fall into routines or assumptions about what the other person wants or needs. But the truth is, people change over time. Our bodies change, our preferences change, and our emotional needs change. What felt good or exciting years ago might not feel the same now, and that's okay. The key is to keep the lines of communication open so that both partners feel heard, understood, and valued. Having these conversations might feel awkward at first, especially if you're not used to talking about intimacy in such a direct way. But the more you practice, the easier it becomes. Start by creating a safe space where both of you feel comfortable sharing your thoughts and feelings. This might mean setting aside a specific time to talk, free from distractions or interruptions. It's also important to approach these conversations with empathy and curiosity, rather than judgment or defensiveness. Instead of making assumptions, ask questions. What does intimacy mean to you? How has your perspective on it changed over the years? What are your hopes and concerns when it comes to this aspect of our relationship? These kinds of questions can help you understand each other on a deeper level and create a stronger emotional connection. But communication isn't just about talking, it's also about listening. Truly listening means being fully present, without interrupting or jumping to conclusions. It means paying attention not just to the words, but to the emotions behind them. When your partner shares something vulnerable, respond with kindness and understanding. Acknowledge their feelings, even if they're different from your own. This kind of mutual respect and understanding can transform your relationship, creating a sense of harmony and trust that extends far beyond the bedroom. Now, let's talk about respect for boundaries, because this is just as important as communication. In any intimate relationship, it's essential that both partners feel comfortable and respected. This means understanding and honoring each other's limits, whether they're physical, emotional, or psychological. Consent is a key part of this. It's not just about saying yes or no, but about ensuring that both partners are fully willing and enthusiastic about the experience. If one person feels pressured or uncomfortable, it can create tension and resentment, which can harm the relationship in the long run. Respecting boundaries also means being aware of how your actions affect your partner. For example, if one partner is dealing with a health issue or physical limitation, it's important to be mindful of that and adjust your approach accordingly. This might mean exploring new ways to connect that feel good for both of you, or simply taking things slower and being more gentle. The goal is to create an environment where both partners feel safe, respected, and cared for. It's also worth noting that boundaries can change over time, and that's okay. What felt comfortable or enjoyable in the past might not feel the same now, and that's a normal part of life. The key is to keep checking in with each other and being open to those changes. If one partner expresses a new boundary or preference, respond with understanding and support, rather than frustration or disappointment. This kind of flexibility and adaptability can help keep your relationship strong and resilient, even as you navigate the challenges of aging. Another important aspect of respecting boundaries is avoiding pressure or expectations. Intimacy should never feel like an obligation or a chore. It should be something that both partners genuinely want to share. If one person isn't in the mood, or if they're dealing with stress or other issues, it's important to respect that and not push them. Instead, focus on other ways to connect and show affection, whether it's through cuddling, holding hands, or simply spending quality time together. These small gestures can help maintain the emotional bond between you, even when physical intimacy isn't on the table. Finally, it's important to remember that every relationship is unique. What works for one couple might not work for another, and that's perfectly fine. The key is to find a rhythm and approach that feels right for both of you. This might involve trial and error, and that's okay. The important thing is to keep communicating, keep respecting each other's boundaries, and keep prioritizing the health and happiness of your relationship. In summary, the relational dynamics of intimacy, communication, and respect for boundaries are essential for creating a healthy, fulfilling connection with your partner. By fostering open and honest dialogue, and by honoring each other's limits and preferences, you can build a relationship that feels safe, supportive, and deeply satisfying. It's about creating a partnership where both of you feel valued, understood, and loved, not just in the moments of intimacy, but in every aspect of your life together. As we age, our bodies naturally undergo changes, some subtle, some more pronounced. These changes are a normal part of life, but they can have a significant impact on how we experience intimacy. For men between the ages of 60 and 88, this might mean dealing with shifts in energy levels, physical stamina, or even sensitivity. It might mean navigating health conditions like arthritis, cardiovascular issues, or hormonal changes. While these changes can feel challenging, they don't have to diminish the quality of your intimate life. In fact, with the right mindset and approach, they can open the door to new ways of connecting and experiencing pleasure. Let's start by acknowledging the physical changes that come with aging. For many men, this stage of life brings a natural decline in testosterone levels, which can affect libido, energy, and even muscle mass. It's also common to experience changes in circulation, which can impact arousal and performance. Joint pain, stiffness, or reduced flexibility might make certain positions or activities less comfortable than they once were. And then, there's the reality of slower recovery times. What might have felt effortless in your 30s or 40s might now require a bit more planning and care. These changes can feel frustrating or even discouraging at first, but they're not insurmountable. The key is to approach them with patience, understanding, and a willingness to adapt. Adaptation is the name of the game when it comes to intimacy in later life. This might mean exploring new ways to connect that feel good for your body as it is now. For example, if certain positions or movements feel uncomfortable, try experimenting with different ones that put less strain on your joints or muscles. Pillows and supports can be incredibly helpful for creating comfort and stability. If energy levels are a concern, consider focusing on quality over quantity. Shorter, more intentional moments of connection can be just as fulfilling as longer sessions. And if physical intimacy feels challenging at times, remember that intimacy isn't just about sex. Holding hands, cuddling, kissing, or even just spending quiet time together can be deeply meaningful ways to maintain your bond. Another important aspect of adaptation is managing expectations, both your own and your partner's. It's easy to fall into the trap of comparing your current experiences to how things were in the past. But the truth is, intimacy evolves over time, just like we do. Instead of focusing on what's changed, try to focus on what's possible now. What new ways of connecting can you explore? What aspects of intimacy bring you the most joy and fulfillment? By shifting your perspective, you can create a more positive and empowering approach to intimacy, one that celebrates where you are now, rather than lamenting what's been lost. This brings us to the idea of a balanced approach. Intimacy, especially in later life, should be light, enjoyable, and free from pressure. It's not about meeting some arbitrary standard or keeping up with societal expectations. It's about creating moments of connection that feel good for both you and your partner. This might mean letting go of rigid ideas about what intimacy should look like and instead embracing a more fluid, flexible approach. It's about finding joy in the process, rather than fixating on the outcome. A balanced approach also means being mindful of the emotional and psychological aspects of intimacy. As we age, it's common to face challenges like grief, loneliness, or anxiety, which can affect how we feel about ourselves and our relationships. Intimacy can be a powerful tool for navigating these emotions, but it's important to approach it with care and sensitivity. If you're feeling stressed or overwhelmed, take the time to address those feelings before diving into intimate moments. This might mean having a heart-to-heart conversation with your partner, practicing relaxation techniques, or even seeking support from a therapist or counselor. It's also worth noting that a balanced approach involves respecting your body's limits and listening to its signals. If something doesn't feel right, whether it's physical discomfort or emotional unease, it's okay to pause, adjust, or stop altogether. Intimacy should never feel like a performance or an obligation. It's about creating a space where both partners feel safe, respected, and free to express themselves. Finally, a balanced approach to intimacy in later life is about embracing the beauty of imperfection. It's about laughing together when things don't go as planned and finding joy in the small, unexpected moments. It's about recognizing that intimacy isn't just about physical pleasure. It's about connection, love, and the shared experience of being human. By approaching intimacy with this mindset, you can create a richer, more fulfilling experience that adapts to the realities of aging while celebrating the unique joys of this stage of life. In summary, aging brings changes to the body and to the way we experience intimacy, but these changes don't have to be barriers. By embracing adaptation, managing expectations, and adopting a balanced approach, you can create a fulfilling and enjoyable intimate life that evolves with you. It's about finding new ways to connect, prioritizing comfort and joy, and celebrating the deep, meaningful bond you share with your partner. Intimacy in later life isn't just possible, it can be a source of profound joy, connection, and vitality. As we wrap up this conversation, I hope you've gained valuable insights into how intimacy, especially oral intimacy, can play a transformative role in your life as you age. It's not just about physical pleasure, it's about connection, health, and the joy of living fully at every stage of life. Whether you're navigating changes in your body, strengthening your relationship, or simply exploring new ways to feel vibrant and alive, remember that intimacy is a journey, not a destination. It's about adapting, communicating, and embracing the beauty of this chapter with curiosity and care. Now, I'd love to hear from you. How do you view the role of intimacy in your life as a vibrant senior? Have you discovered new ways to connect with your partner or adapt to the changes that come with aging? Share your thoughts, stories, or questions in the comments below. Your experiences could inspire and support others in our community. Don't forget to hit the like button if you found this video helpful, and if you haven't already, subscribe to the channel and ring that notification bell. By doing so, you'll stay updated on more empowering conversations about health, relationships, and living your best life as a vibrant senior. And if you know someone who could benefit from this message, whether it's a friend, family member, or partner, share this video with them. Let's spread the knowledge and create a community where we can all thrive, no matter our age. Thank you for being here, for engaging, and for embracing the journey of aging with vitality and joy. Until next time, take care of yourself, cherish your connections, and keep living vibrantly. See you in the next video.